exposure to federal retirees than others. I would say, by and large, most of those folks that are either retired from or getting ready to retire from federal service are going to be eligible for their retiree health insurance program. And their benefits as a retiree are administered by the Office of Personnel Management, or OPM.gov. When I went and looked at the OPM.gov website yesterday, I noticed that there was a couple additional plans available. It used to be like 12 nationwide choices. Now there's 13 specific groups. If you served in the Foreign Service or you were a rural postal carrier, they have some specific insurance plans that are for their offices only. And then there are some state-specific participants, like the Kaisers and the other providers who have HMOs, HDHP, high deductible health plans, which we don't normally deal with a whole lot in the Medicare world, and then something else called CDHP, and we'll take a look at those, consumer-driven health plans. High deductible and consumer-driven health plans offer some funds to spend against those out-of-pocket costs, but then their benefits don't kick in right away. You have to use those funds first oftentimes, and then possibly you have some benefits after you have a certain out-of-pocket expense. A few years ago, the federal retiree options changed. It used to be that it could be just the retiree, which would be self-only, or it could be the retirees and their family. So there were two options. Because so many retirees don't have large families, most of them are empty nesters, they added a third option called the Self Plus One. So it's the retiree plus their legal spouse most often. So it's going to be a couple. Most of the employees, after they have concluded their active work service, are going to be eligible to enroll. Like many other retiree plans, in order to be eligible, you have to have a pension. So if you've only been a federal worker for a very short amount of time and you haven't earned a pension, that may complicate things. But for the most part, retirees do have a pension, and they can continue their existing insurance just like they were working into retirement. But like many of the other retiree health insurance policies, we keep getting some feedback, sorry about that. Once somebody declines to go with their retiree option, their health insurance retiree option, they are not allowed to re-enroll. This is the same thing as with PERS or with many other retiree options. The only difference with the federal group is that they have something called suspended benefits, and we'll talk about that further on. So federal retirees are one of the only groups that I know of. I have not encountered any other group that allows their retirees to suspend coverage to go participate in some other health insurance program, and we'll take a look at what those other programs might include. I keep forgetting I can't use my directional arrows. The plans that folks are allowed to participate in if they want to suspend their federal retiree benefits would include Medicare Advantage plans. In order to have a Medicare Advantage plan, you have to have enrolled in Medicare A and B. If you want to possibly have your TRICARE or CHAMP VA be secondary to Medicare, then that would also be a reason to suspend federal retiree, federal employee health benefits. Again, you have to have both A and B in order to have TRICARE or CHAMP VA work as a secondary to Medicare. For some folks, maybe they were federal employees for a shorter amount of time and their pension is very low. They may actually qualify for Medicaid benefits. So they could suspend their federal employee health benefit plan, which has a pretty, substantial premium oftentimes, and then they would have their Medicaid as secondary to Medicare. Again, if you are enrolled in A and B, sometimes those state benefits are going to pick up some of those premiums for B and or the out-of-pocket costs associated with Medicare. And then the last item on there is we do have a fair number of federal retirees that in their retiree life they want to go and travel or volunteer. So Peace Corps does have health insurance, and that is another reason why somebody might want to suspend their federal employee health benefits so that they can take advantage of those Peace Corps health insurance benefits and not have to pay a premium. There are timelines associated with that suspension, and there is a form that has to be filled out. I didn't see anything on there. Then there is a form that is available, obviously, online. But most of the guidance I read yesterday in the frequently asked questions said, please contact the Office of Personnel Management and discuss that suspension with somebody at the Office of Personnel Management. Okay, I thought maybe we had a question. I could hear somebody talking. If someone wants to suspend, they do have some timelines. So let's just say somebody has an opportunity to enroll in TRICARE. So 31 days prior to their start of TRICARE or within 60 days after qualifying for that TRICARE, they would need to enroll or suspend their federal. But now I'm looking at the bottom, any time to switch to TRICARE for life. So just keep that in mind that there are some timelines in there if you want to suspend. I'm thinking maybe going into a Medicare Advantage plan. That might be something. Timing is going to be critical. In the fall, you're going to want to have that person submit their suspension form so that on January 1, the Medicare Advantage starts and the federal employee benefits end. And then the following year in open enrollment for, or annual enrollment for Medicare Advantage, you would say, no, I don't want to keep my Medicare Advantage. I want to unsuspend my federal, and I'm going to go back on the federal side. So just keep in mind that if folks do want to take advantage of that suspension, then they do have to have a conversation with OPM staff and process those forms. Premiums are fairly similar to what an employee for the federal government would normally have withheld from their paycheck. Enrollees pay about 30% of the full rate. And then when I was looking at the rates for this next year, depending upon the type of coverage that somebody wants, the premiums are as low as $97 for an individual and up to $390. So depending upon, where you live, what's available, what branch of the federal government that you participated in, you may have a subset of that range or the full range, depending upon your circumstances. There is a lot of information on opm.gov, easy to pull up. A lot of the website is pretty intuitive once you know exactly where to go, but I did offer this link or URL path to get to the compare plans portion of the website. It's under insurance and then under healthcare, and then you can go to the compare plans, and you have to click on the state of Oregon or put in Oregon. So this is kind of what it looks like. That's what opm.gov looks like. And you go to the healthcare plan information, compare plans, and then if you click on that little Oregon state right there, it'll pull up another screen, and it'll give you information based on plans that are available in Oregon. When someone is a federal retiree, they have an opportunity to make plan changes once every year, similar to the Medicare annual election period, only their season is called open season, and it does kind of coincide with hunting season. So it's described as the Monday of the second full work week in November through the Monday of the second full work week in December. And this translates this coming fall to November 9th through December 14th. And it does change from year to year. This year happens to be that November 1st is on a Sunday, and so we're going to get the full second week is going to be the full work week. And they don't take into consideration, I don't believe, what is the holiday that happens in November? Veterans Day. If someone is turning 65 or retiring, that is a qualifying event, and so they are allowed to jump into the retiree side of things because of that qualifying event. There are other qualifying events, marriage, divorce, adoption, having a child, a death in the family, so lots of different qualifying events, but knowing that Medicare, aging into Medicare or retiring and going on Medicare as a result of retiring is a qualifying event. When somebody is in any of the plans other than self only, the feds say anytime during the year, if you want to switch from whatever that is, self plus one or family coverage, to just self only, you can do that. So let's just say a couple have self plus one, and maybe the spouse goes back to work and has an opportunity to get health insurance from their employer. That would allow the federal retiree to switch to the self only option. That's a pretty common occurrence, I would think. One other thing I want to make sure too is like PERS and like other retiree plans, when someone chooses how much they're going to take as far as their monthly pension, they have a choice of either getting the full amount and it's just for them, so that if they were to pass away, their surviving spouse would not get a pension, and that could boot them out, that surviving spouse, out of that retiree health coverage. So one of the questions that I always ask when I'm counseling a federal retiree and maybe their spouse at the same appointment is, how are you going to set up your pension? Do you want your surviving spouse, should you predecease them, to be able to keep that insurance? The only way they are able to keep the insurance is if they are also the recipient of that pension after the retiree has passed. So that's a real important question. If someone is taking the full amount and expecting to outlive their spouse, that may be one reason, but for that spouse to get the insurance, they are going to have to get that pension after the retiree has passed. So there are ways that folks can contact the Office of Personnel Management during open season. Here is their website so that folks can fill out the proper forms to make a switch, or they can call. I have not had a good response from OPM in terms of responding to my calls. So and even emails, they have been very, very slow to return emails. So I would not necessarily recommend calling or emailing, but if someone is self-motivated and can go online and fill out all the paperwork to make those changes, or with assistance, oftentimes that's a much quicker task than trying to get a hold of somebody in person to respond to anything. Outside open season, it's maybe a little bit quicker, but not much. I've contacted them both in the open season and outside of the open season, and it's still pretty slow either way you look at it. So, but there is information available. Folks can certainly call and talk to somebody. I would counsel them to make sure that if they have a cell phone, that the cell phone is either plugged in or the battery is fully charged, because there could be a substantial wait time in getting a live human being to answer. So let's talk a little bit about the types of plans that are available under the federal health plan program. We've got your typical PPOs, and those are considered fee-for-service. You go in, you get a office visit or a service, and you pay a fee or a cost share. They also have HMOs, similar to what we have under the Medicare program. Again, you're going to go in and have a service or an office visit, and you're going to have a cost share. The consumer-driven health plans are the ones that I was mentioning earlier on, where there is this bucket of money. It's, somewhere around $1,000. You use that bucket of money for your cost shares when you go in for your office visits or your services. And then there is a gap. Maybe there's another $1,000 or $1,500 where you're going to pay full cost until you exhaust that deductible, so to speak, and then your insurance kicks back in. So you have a bucket of money to use up front if you want to go get some services. Then you have a deductible period, and then you have your health insurance benefit period. So consumer-driven is how they have termed that. The consumer gets to say, oh, no, well, I'm not going to, it's not serious enough, I'm not going to go to the doctor over this. That bucket of money rolls over for the next year. And so you can start accumulating a fair amount of funds to use for things that may have a higher out-of-pocket cost. I'm thinking in terms of dental, crowns, root canals, implants, that sort of stuff. The last one on here is the high deductible health plans. Just like it sounds, you have this higher deductible that you pay full cost until you exhaust that deductible, and then the health insurance kicks in. High deductible health plans have typically been the lower monthly premiums. Consumer-driven health plans are a little bit higher, but still on the lower end. The HMOs are probably the third tier up, and then the fee-for-service PPOs are going to be the highest premiums. So depending upon how much somebody wants to spend on their monthly premiums for their health insurance, healthy people are probably more inclined to go with the less coverage and the lower premiums. People who have more chronic conditions or are less risk adverse or more risk adverse and want to have that full coverage no matter what happens are going to be spending a little bit more on their monthly premiums. And we'll take a look at some of those monthly premiums. They're not a real big difference, but you saw the range. $97 is the low end, $390 is the high end, and again, that's going to depend on where and what is available in specific areas or retirees from specific agencies in the federal government. And I know we have quite a few SHIBA counselors who are federal retirees. So, certainly when we open it up later on, if you have input, I'm more than happy to have you give us your experience so that we can learn from people who are actually in the program rather than just me talking about it from an analytical standpoint. When we're counseling somebody, it's very similar to counseling somebody, I guess, that's looking at Medicare choices. Some people want to have a lot of coverage and they don't mind paying more for it. Other people are okay with having the lower premiums because they're not experiencing any high medical expenses. So it's very individual and subject to their own experiences and their own family needs. Now, I will say something. I meant to mention this when we were talking about the suspensions. What I was reading yesterday is family members who are on a policy with their retiree, if the retiree suspends, the whole policy gets suspended. So the retiree and any dependents or spouses are going to be suspended as well. So you can't suspend just for one person and let the family stay on or the spouse stay on. It's going to be everybody or nobody. Okay, so let's talk a little bit more about those consumer-driven health plans. It has a traditional health plan benefits, but like I said, there's this pocket of money that you can use for your medical and dental. Typically, like I said, when we were looking at it, it was about $1,000. So if somebody has something that comes up in the middle of the year, maybe they need a root canal, they can spend that money on whatever they need during that year. But they typically don't have chronic conditions, and they're not really looking at spending a whole lot of money on health because they're relatively healthy and they don't anticipate. But they have that use of those funds until they exhaust that bucket, and then they have that deductible period. When that fund is exhausted and the deductible is met, then their health insurance just has traditional benefit structure. Sometimes it's 80-20, sometimes it's 70-30. It's helpful to look closely at those cost shares or co-pays to make sure that that is the level of coverage that somebody wants if they were to go through the initial funds and the deductible in getting into the actual traditional health benefits. If someone doesn't use that first bucket of money, then it does roll over from year to year. So it's similar to a high deductible health plan that has what's called a health savings account, and maybe the employer or the employee is funding that health savings account, and they're collecting those funds for use later when they have more need for some additional financial resources to pay for those medical expenses. So the consumer-driven health plans have something similar to that. It is not really considered a health savings account, however. So it doesn't fall under the same rules, the IRS rules, as a health savings account. High deductible health plans are the only vehicle that the IRS allows when somebody does have a health savings account. You cannot have any additional insurance other than that high deductible health plan unless it's an indemnity, no major medical. So you could have a cancer policy, or you could have some other dental insurance if you had a separate policy, but you wouldn't have major medical. You would have the high deductible health plan as your major medical, and then you, the retiree or the employer, would be contributing in funds into an account that is governed by IRS rules. And it can be invested, and you can earn interest or dividends or however it is invested. For people who are enrolled in Medicare in some way, they are not eligible to have contributions made to a health savings account. And the IRS, while I haven't seen anybody get caught in that conundrum, it is on the books, so they are at risk if they do continue to contribute to the health savings account while enrolled in Medicare. It could come back to bite them. Both the taxpayer and the employer could be subject to penalties and fines. So for those folks who want to be enrolled in Medicare or have no choice, because if they're collecting a Social Security retirement benefit, they are going to be enrolled in Part A of Medicare, there is something called a health reimbursement arrangement. And that was created to help those folks who want to be in a high deductible health plan. They want to have a pocket of funds to draw upon during that high deductible period where they're responsible for all of the out-of-pocket costs. But they don't want to be on the hook if they were to have tax consequences of funding that health savings account. So the health reimbursement arrangement allows a Medicare beneficiary to still have a pocket of funds available to them for their out-of-pocket costs without having to meet the qualifications of a health savings account contributor. Health reimbursement accounts are only contributed by the employer. They are not contributed by the employee. So that really does make a big difference. But it does allow people to roll over from year to year as long as they stay in the same type of plan. It's not theirs to keep forever, but they do have it as long as they stay in that type of plan. So here's kind of a side-by-side comparison between a health savings account and a health reimbursement arrangement. So you can just read the differences, difference between who can make eligible contributions, what is investable, what isn't investable, and whether or not it's portable or not. So the health reimbursement arrangement does have a lot more constraints on it than the health savings account, but the health savings account is not available to folks who are enrolled in any part of Medicare. When the federal presentation was made some years back, and I did the webinar, one of the things that they touted was that federal employee health benefits can fill most of the gaps in the Medicare for services covered by their plans. So I thought that was kind of interesting, and they even termed it as an inexpensive Medigap policy. And I guess that's one way of looking at it. I didn't necessarily see it as inexpensive. I saw it as comparable to what somebody might pay in terms of a Medigap policy. But the benefit, of course, with going with the federal side is that the insurance includes some drug benefits and some dental benefits. So while you are paying a premium that is 30% of the going rate, or whatever the full cost is, it does include more benefits than a traditional Medigap policy would include. When I started looking more closely at some of those benefits, there are plans, and I'm going to just pick out a couple of them. Blue Cross Blue Shield is one, that if you are enrolled in both A and B Medicare, so you're paying a B premium on top of your federal retiree health insurance premium, Blue Cross waives the deductibles and the cost shares. For somebody who has a lot of medical services in the year, that could be substantial. So for $145 and up, because federal retirees, depending upon how many years they contributed to their pension and their service. Some retirees do get a substantial percentage of their last income based on the number of years of service. So just a case in point, I have a family member who is a federal retiree. He spent more than 40 years in federal service, and when he was looking at adding his Part B, he was at the high end of the IRMA scale. And in his situation, he was a Kaiser member in Virginia and decided, well, gee, I don't even need to have my Part B if I'm going to continue to have Kaiser coverage. And the B was not going to offer any additional benefits. It wasn't going to waive the co-pays in his circumstance. So his decision to forego his Part B was a financial one because he wasn't going to be paying the starting rate of the Part B premium. He was going to be paying a substantial amount more on a monthly basis, and it wasn't going to be in his financial best interest to have both A and B. But most people who are at that $145 range and they want to have that additional waive of their cost shares, that might be something that they would definitely want to look into. So just keep that in mind when you're talking to some of these federal retirees, that their Part B premium may be higher due to IRMA based on what their pension is going to be in their years of service. If someone's still working, it's similar to anybody else who's still working. The federal guidance is to have those employees sign up for Part A. You know, we've had these conversations in the past. Enrolling in Part A pretty much tells folks, hey, I'm in Medicare now, I can no longer be a contributor to my HSA, my health savings account. So having that discussion with those folks that are still in their work environment, actively working, not a retiree, is a good idea, because we don't want them to jump into A just at 65 just because it's available if they are contributing to that HSA. So I've had several people who were not aware that that was going to adversely affect them. Part B is usually not a consideration if they're still working. Why pay an additional monthly premium when you're working and you have good health insurance coverage? You can apply for B anytime while you're working and up to 8 months after you stop working and be without penalty. So for folks that maybe are still working and maybe they have a health emergency, they could definitely jump into B if they thought that that was going to work in their favor. For folks who are approaching age 65 and getting ready to retire, or over age 65 and getting ready to retire, certainly if they have paid into Part A, they will get their Social Security retirement benefit, and it will come with their Part A. Very rarely I do run into people who are part of civil service, and they spent a number of years before they contributed to Part A. That all changed, I believe, in 1986. But for some of our older retirees, they did not pay in to Social Security Part A, and so they are not eligible for any of those benefits. But for most folks who are now just recently retiring, they're going to have that Part A available, and depending upon whether or not they're going to have other insurance, maybe their spouse is continuing to work, or maybe they are going to stay in that retirement period before they jump into B, they may want to reevaluate whether or not B is going to be worth their additional premium payment or not. The thing to talk about with some of these folks, however, is if they are working and getting ready to retire and they are enrolled in one of those high deductible health plans and they are contributing or their employer is contributing to a health savings account, they need to stop those contributions at least 6 months prior to starting Medicare, because A is going to retro back 6 months, and that is going to adversely affect their ability to be a contributor. So keep that in mind if somebody is 66 and a half or older. If they're 66 and a half, it's going to go back to their, 65 and a half, it's going to go back to their 65th birth month. And anything older than 65 and a half, it's going to retro back 6 months. For folks who want to go into the regular fee-for-service, that would be the preferred provider organizations. When somebody is enrolled in both Medicare A and B, there's a way that we can see whether or not those plans will waive any of the deductible and cost shares. So hopefully when I get ready to share the screen, we can find that on the opm.gov website. The federal employee will always still be primary for benefits like prescription drug and dental and things that Medicare doesn't cover. If it's a Medicare covered service, then Medicare is going to be primary and the FEHB policy is going to act as a secondary. For HMOs, this is similar to what my family member was explaining to me. HMOs don't waive the cost shares typically, and so they may not feel that Part B is in their best interest. Now, I believe there are some additional Kaiser benefits in the state of Oregon where it's a Kaiser plan that actually will contribute to having that Part B premium paid. And I might have some of our federal retiree folks who are either enrolled in that or familiar with that plan give some of their input, because I'm not familiar. I haven't counseled anybody with that particular plan, but I know it exists, and it is fairly recent that it has been made an option, I believe within the last 3 years. So folks who are going to be participating in those HMO plans may or may not want to have B. The only caveat to that is if that HMO carrier decides to pull out of the federal retiree offerings, now somebody is left with only fee-for-service and they don't have their B. And what happens with those cost shares? Those cost shares may be pretty high. And if they go to enroll in B, guess what? Federal retirees do not have any protection from the late enrollment penalty. Only active work group health benefits under Social Security law protects people from late enrollment into Part B. Retirees, even in the federal retiree system, even though their retiree plan works fine in the absence of B, if they want to jump into B later, they are going to be subject to that late enrollment calculation. Okay, so I guess I got ahead of myself here. If the HMO plan leaves the federal program, then, somebody may end up paying those cost shares, or if they want to enroll in B, they're going to have that late enrollment. If they wanted to suspend their coverage and go play in the Medicare Advantage side, they're still going to have their A and their B, because Medicare Advantage requires all participants to have both A and B, because that's what they're managing. Same with TRICARE. TRICARE for life. I should make the clarification on that. TRICARE for life retiree coverage does require their participants to have both A and B. One last thing, too, that might work in a federal retiree's favor is if they have their HMO and they want to go outside that HMO. If they have Part B, they can go outside that HMO and still have benefits. And it'll just go straight to the Medicare side because the HMO says, nope, you're outside of our network. We are not going to pay anything because we haven't given authorization or a referral outside of our network. So having B with an HMO in some circumstances might actually work in that retiree's favor. Folks who spent at least 20 years or longer in the military or career military, they may have benefits. So if they retire from the military, in order to continue with their TRICARE. TRICARE is when you're active member. It works just like an employer coverage. You get your TRICARE benefits while you're actively working. But when you are retiring from active military service, in order to continue those TRICARE benefits at or past age 65, you need to enroll in your Medicare A and B. And then TRICARE for life becomes your secondary insurance. If you have both Medicare and federal and TRICARE, you'll see that the coordination of benefits there. Medicare is first, federal health benefits is second, and then TRICARE would be the tertiary or payer of last resort. And I should, again, qualify this as TRICARE for life, not just TRICARE. So TRICARE for life is a little different than TRICARE. TRICARE implies that you are actively working. TRICARE for life implies that you have retired from military service and you are now on the Medicare side of things. Okay, so Medicare Advantage, we all know probably more about this than the average bear. For folks who have A and B, they can decide to suspend their federal health benefits and go play in the Medicare Advantage side of things. Timing is everything, so you have to jump into Medicare Advantage at a particular time of year. Usually it's during the fall annual election period for a January 1 start date, unless you have some kind of a qualifying event. And you have to process those documents, those forms, to suspend your federal coverage so that everything kind of lines up. Your federal coverage is going to last until the end of December, and then once your suspension takes effect, your Medicare Advantage is going to kick in on January 1. So just make sure if people are talking to, maybe I want to go check out this zero premium plan in my area. That's pretty attractive to a lot of people. Instead of spending, you know, $200–300 a month in monthly premiums, I want to go try that zero premium plan with drug coverage. Well, you know, again, timing is everything, and they're not going to be able to get out of that zero premium plan until the next annual election period, and then they can unsuspend and come back to the federal retiree benefit. Very similar rules in the federal side as we have in the Medicare side. If anything is lost, any coverage is lost involuntarily, that opens up a qualifying event so that they can replace that coverage. So they can, if they lose their Medicare Advantage plan, maybe that pulls out mid-year like Family Care did a couple of years ago in the end of June, they could go back into the federal health benefit program and unsuspend because they lost that coverage through no choice of their own. But if they choose to disenroll, then timing again is going to be everything. So try and counsel those folks to make those choices at the appropriate time during the year when they can get out of a Medicare Advantage plan when their enrollment back into the federal employee benefit plan is going to be available to them. Just stopping your premium payments, if there are premium payments, as we all know, Medicare Advantage plans is not a special enrollment period. So just because somebody is dissatisfied with that Medicare Advantage plan doesn't mean that they're going to be able to make a change in the middle of the year. Federal plans all have drug coverage. I was looking at one the other day between Blue Cross Standard and Blue Cross Basic. We had a caller who had been prescribed Xarelto. Xarelto seems to be coming up a lot recently. We've had a lot of folks say that their physicians are now prescribing that. It must be the new darling compared to warfarin. And Xarelto retails right around $500 a month. And depending upon what level of federal plan you have, the cost share could be anywhere from copay $45 to $75 on up to 20 or 30%. So we would want to give some idea to those folks what their cost shares might be, and you can go look at those cost shares. All of the evidence of coverage documents are available on the opm.gov website. So just letting folks know that their plans do come with drug coverage, but if they have a really expensive medication, it might be in their best interest to also enroll in a Part D plan. And those two do coordinate. I had a woman down in Southern Oregon who had a very expensive maintenance medication post-cancer, and she was exploring whether or not her federal and a Part D plan would coordinate. And we got on the phone with the Blue Cross federal side of things, and they said, yes, absolutely. Whatever we would normally pay, we would pay. And then if your Part D plan is contributing to that, we're still going to pay what we would normally pay. So that's going to reduce her out-of-pocket cost. Probably going to involve a little bit of manual coordination, sending claims. Obviously, at the point of sale, they're going to go to the primary, which is going to be the Part D plan, but then also making sure that those claims are getting processed by the secondary insurance through the federal. So for folks who think that they may get some benefit from the federal prescriptions and the Part D, that is something to explore. Folks who are just in the federal side cannot apply for the low-income subsidy. You have to be in the Part D side to get that low-income subsidy if you are eligible. So you could certainly apply for it, and then if found eligible, it would be an automatic enrollment, just like we have for most Medicare beneficiaries. Choice counseling to get into the most appropriate Part D plan to help with that would be obviously something that we would want to do with those folks. This was something that the federal presentation said, that federal retirees will not likely benefit from enrolling in a Part D, unless, of course, they have a very expensive medication and they want that coordination, like the gal that was down in Southern Oregon with that long-term maintenance drug that was going to be very expensive post-cancer. And it wasn't something that was going to be covered under her medical. It was going to be covered under her prescription. So that might be something to consider. All right, so this is our last slide, and then I'm going to go take us on a little tour of the OPM website. Federal retirees are not required to enroll in Medicare. These are two federal programs that are pretty much standalone on either side. So you can have the federal retiree health benefits all by themselves without Medicare. Or if somebody wants to, they can also enroll in Medicare, and sometimes that will help coordinate with those deductibles and out-of-pocket costs. If someone is still working for the federal government, they can defer that Medicare enrollment until they get ready to retire, just like anybody else. But the thing that is a little bit different with federal retirees is they actually can suspend if they are enrolled in both Medicare Parts A and B, and they want to go check out some Medicare Advantage plan, or they have TRICARE, or they have Peace Corps, or whatever qualifying health other coverage that they may be eligible for. Medigap policies are not going to work well with federal employee health benefits because in most cases, if you are in A and B and you have a federal policy, it's going to act as your secondary, and that's going to help defer some of those out-of-pocket costs. And in most cases, Part D is not going to be needed because they do have prescription benefits, unless, of course, there are extenuating circumstances where someone has a very expensive medication, and we can run the numbers. We can talk to their federal prescription drug benefit to see if that coordination is going to be in their best interest. And then, of course, the last thing is once somebody is enrolled in Medicare, even if it's just Part A, they can no longer be an active contributor into that health savings account. And that is governed by the IRS rules, and I believe it is Publication 969, which outlines when somebody can contribute to a health savings account. And enrolling in anything other than a high deductible health plan eliminates that eligibility. So Miranda, I'd like to maybe go over to the OPM website and do a little sharing. Okay. Okay, let's go here. This is what, I hope everybody can see this. This is what the opm.gov website looks like. Lots of information on here. But for our purposes, go to insurance and then go to healthcare. This is the address that I was showing you earlier. And then if you want to go down here to plan information, see, it gives you that nice little map. Click on Oregon. And here are all of the various plans that are available depending upon the area that you live in or the agency that you worked for. In order to look at a particular plan or see some of the premiums, let's go to the compare plans. And I'm just going to put in Salem as a example. And we're always going to, if it's a retiree, we're always going to check annuitant. That means that you're receiving a pension, and it's going to default to monthly. So it's going to give you premiums by month instead of, you know, somebody who's working and getting paid in a different period. So if you have somebody who's got a current plan, maybe they've got a Blue Cross or a GHA or something, you could pull that up. But let's just look and see what's available in the Salem area. And again, it's going to be subject to agency. If they were a rural postal carrier, they may have something available to them that is not available to somebody else. So here we can compare 3 plans at a time. The most common that I have seen in my counseling has been the Blue Cross. There's a basic and a standard, and those 2 Blue Cross plans have different cost structures. This little one person icon is a self. The next one down is self plus one. And then, of course, the last one is going to be the family rate. And you'll see when we pull up some of these comparisons, I'm just going to pull up the Blue Cross and the basic benefit and the standard benefit to compare. And then down here, we can hit compare. And this will give us a nice little side-by-side. Now, what I'm thinking is I want to look here is Medicare coordination. Medicare coordination tells you, yes, their deductibles are waived on the Blue Cross standard plan. It doesn't apply. There is no deductible on the basic benefit plan. They also have an out-of-pocket maximum, but a lot of times those maximums don't really come into play because all of the cost shares associated with services, there is none. Medicare is contributing, and so they're waiving all of those additional cost shares. In this case, the standard Blue Cross plan is going to help contribute to that Part B premium up to $800. So 145 times 12 is about a little over $1,700. The Blue Cross basic benefit plan is going to contribute almost half of that monthly premium. So that's a nice little benefit right there. So nice website. It works really well. If you want to go back and look at some of their hot links, you've got summaries of benefits, you've got websites, you've got evidence of coverage on the previous page, lots of really good information, especially for people who are deer in the headlights, don't have any idea how to even start with this whole process of looking at their insurance options. So take a look at this, hot nose around, see what you can find. If you have any questions, that's about all I've got. I think it's pretty intuitive so that you can see what exactly the folks have options for. And then I'm going to say, Miranda, let's open it up to anybody who might have raised their hand and wants to give us some input on their particular, how do I get back? Help, Miranda, I don't know how to get back to our slide deck.
I'm trying.
Okay. We'll go back to OPM until we can get the slide deck up. Okay.
Food shopping.
Anybody wanna chime in on what? There we go. It might be a real life example.
I was thinking that we should use potatoes.
There's only two.
If you could raise your hand, and I will give each individual person access to talk. That way we don't have a bunch of clutter in the background. That would be awesome. And if you are not speaking, could you please mute your phone?
Why don't we do two now?
Okay, let me see if I can mute this person. Okay. Would anyone like to ask a question? You can raise your hand by going to the top dark gray bar. There's a little person raising their hand. Just select the down arrow next to them and then raise hand. It's the very top option. Or if you'd like, you could use the chat option and say, I have a question. And just so no one worries, we are not currently sharing any content on the screen. Right now it's just question and answering with Donna, your presenter. Any questions? Okay, it like Julie Dean does have a question. She put, what
Okay.
about the late enrollment penalty if you add a Part D after age 65?
Late enrollment penalties do apply. So depending upon if somebody, how long they have been without Part B, it's 10% for every year.
Part D prescription drug.
Part D prescription drug, no. Federal drug coverage is considered creditable, and so there'd never be a penalty associated with Part D as in drug.
Okay. Okay, does anyone else have any questions before we wrap it up?
All right, not hearing any additional questions. Thank you all for attending. We really appreciate your ability to join us, and we hope you have a wonderful day.